what can I do to protect myself against COVID-19? I was going to ask you to tackle this one and give some general advice. I know you've done some to protect ourselves.
I think someone may have been unmuted for a bit. So how do you protect yourself from COVID-19? So that all stems back to how the virus is transmitted. And your intro was awesome. If you ever want to come to ID and change fields, we'd love to have you. Can you guys hear me okay?
Yeah, so can I ask if anybody's on the phone? If you're on the phone, can you please mute your line? If you're on the phone, please mute your line.
Okay,
I think
great.
we might be good now.
Okay, so how do you keep from getting COVID-19? We have started along that line, but I'll take half a step back to the intro just as a reminder. So this is a virus that spreads from person to person, at least. We think best evidence right now is that it's primarily spread from person to person by respiratory droplets. And the difference between a droplet and airborne is that droplets are bigger particles produced, little tiny droplets of liquid with virus in them that are produced when someone coughs or sneezes, generally not when you're just regularly breathing. They're bigger than little tiny bits in the airborne context, and they're called droplets, as I like to tell people, because they drop. And that's why the 1 meter that's recommended by the Public Health Agency and the 2 meters that's recommended by your group is really important. Those droplets that contain virus drop out of the air pretty quickly because they're relatively heavy. And that's why the social distancing thing is so incredibly powerful in terms of keeping away from the virus. And so what I meant by that is social distancing means staying out of the respiratory range, I like to call it, of the person in front of you. And so if you stay out of the respiratory range, life gets better. It's not enough, though, because other people are around you. And while other people, and I think Canadians are actually doing a pretty good job, they're not mostly 21 on Miami Beach saying that this is not all about them. Most Canadians are trying to make an effort, but still there may be points where these viruses drop onto surfaces around you. Somebody's got to get groceries at some point. And if that virus is there, it can live for a little while. And if that's the case, what can happen is that you touch it. The virus doesn't jump. So part of the challenge at times like this with all the new information is that we forget the basics. Viruses don't jump. And so if you've got it on your hands, it's on your hands until you touch your face. And the way it gets in is eyes, nose, and mouth. And so if you touch your hands to your face before you wash your hands, that's a great way in a public spot with high touch areas, mouse, keyboard, doorknobs, elevator buttons to get something into you. So don't do that. Wash your hands lots. Don't pick your nose. I know nobody picks their nose, but don't pick your nose. And honestly, jokes aside, don't bite your nails. I'm a face toucher. Someone's had to do this to me every day this week. Get your friends and family around you. It's a great way for them to go, don't touch each other and don't touch your hands to your face. So that's a couple of ways that you can prevent the spread of virus. But the other bit, other than social distance, wash your hands, don't touch your face, is also disinfecting surfaces around you, as I've just alluded to. And that's so important. And I've said it before earlier, but using a disinfectant that's recommended, the websites I go to myself are the Public Health Agency of Canada for suggestions on good disinfectants, as well as your local or provincial authorities, and it's really important. So again, not sexy, but really important and really, really effective in terms of what you can do to protect yourself against the virus. 2 meters. That's a long way. We think we're being rude with people, right? We feel uncomfortable if someone walks towards us and we back away. It's okay these days. Stay away and just remind people, oh, just keeping my distance, and no tripping people up or anything, but keep them away from you.
That's great advice. And there's actually some new data coming out of gastroenterology journals that there is actually virus that can shed into the stool. And the one thing that I would stress, even though we can see some virus in the stool, that all of the recommendations that Lisa has just said about hand washing, about distancing, it all applies to that mechanism as well. So if there is any fecal transmission, key thing is to wash your hands. And I've been really working hard to try not to touch my face. And I know that this is going to be videotaped, and people probably can actually count how many times we've touched our faces during the context of this video conference.